People also aren't really aware of how depressing opioids are. So you can imagine being in an NHS hospital, it's depressing as it is, and you are being pumped basically with depressant, and you go crazy. I come out of hospital and I'm in the worst mental health state.
Hi, everyone, and welcome back to Harmonia Podcast. Today, we are joined by a lovely patient, Lydia. Hi, Lydia.
Hi.
Lydia, thank you so much for coming on here today to talk about your patient experience. Before we, I suppose, dive into it, why don't I hand over to you to do a little bit more of a formal introduction?
Hi, my name's Lydia. I've been a medical cannabis patient since 2022. It has completely changed my life, and I take it for both mental and physical health conditions. So yeah, in 2019, I had a routine operation that went wrong, and unfortunately, the laser hit my kidney, which then left me in chronic pain. Um, and your kidneys are the only organs that don't regenerate. So once you mess your kidneys up, they're messed up. So I was 21 when I was diagnosed with chronic pain, and I was bed bound. Um, yeah, relying on my boyfriend at the time. He was doing absolutely everything, on huge amounts of oxycodone and morphine, and that was just making me the pain bearable, but not. I didn't have a life, if that makes any sense. It was just bed, really. Um, and yeah, there wasn't really no one could really tell me what was going on or how my life would be, which is then when I fell into quite severe depression, as I'm sure anyone would be. Um, and then all the psych meds started, and they never really helped because I think I'm quite a holistic person. I don't like to rely on pharmaceuticals. Um, yeah, it's just not really me.
Yeah. No, I know. First of all, you mentioned a few really important stuff there, and I completely understand what you mean. So I think like the first thing is, I completely get what it means like to be diagnosed with a chronic illness at such a young age. I wasn't as young as you. I started experiencing my symptoms at 22, and then got diagnosed at 23. So I get it. Like you're like everyone is out enjoying their lives and we're sitting here with like our whole plan of how are we going to manage our health, like yeah, such a great life, and we have to do that from bed because who's moving out of bed, like who can even do that, and I get what you mean as well by being on copious amounts of opiates, and I had exactly the same experience, so I really feel for you, like you're taking, and I mean handfuls and handfuls, and all it's doing is allowing you to be comfortable enough to lay in bed, and that is it, and you're like, what the hell is this, like.
Still on number 7 of the pain scale. We never get under 5. We never get moderate. It's still severe. It's just enough to stop us crying. That's it. It's awful.
It's terrible, like and it's funny because when I think about it, when I think about people who I suppose judge people for having a cannabis prescription, I just look at them and I think to them, do you really understand what we're going through? Do you really understand these opiates that you'd rather push down my throat? Not only do they not really do much for the pain, right? But they come with its own symptoms, and those symptoms double down on those existing symptoms I already have. And I always say, by some miracle, if they do work, yeah, let's say you did get to 5, because every once in a while it does surprise you. You're like, oh, yeah, I am so spaced out of it and in another dimension that it doesn't even matter that it worked because I still can't get out of bed because first of all, I didn't even realize.
Exactly. No, I literally say that to my friends all the time because I was on Oxynorm liquid, and I had a doctor say to me, that's liquid heroin. So whenever I have one of my friends getting arsy at me, being like, oh, no, you're just being a stoner, I'm like, oh, so you'd rather me be on liquid heroin? or would you rather me have cannabis? And then their face is just like speechless, because no one can argue that liquid, how can, please tell me how anyone can argue that liquid heroin is better for you than cannabis. I, I don't get it, and yet we're in a society that still thinks it's more acceptable for us to be on oxycodone than cannabis, which is just madness.
No, it's completely insane. And, for me, I like to really, this is why patient experiences are very important, because we really need to start sharing what this medication does for us. And I suppose, as somebody who has been on opiates and who's now on medical cannabis, I know you mentioned obviously the pain is slightly diminished, but can you talk about, I suppose, your health and how that helps you and what sort of challenges you experience on a daily basis that are, I suppose, managed by medical cannabis?
Oh, I mean, medical cannabis has absolutely changed my life. I personally, and this might sound very dramatic, I don't think I would be here, um, in terms of without medical cannabis. I went from being bedbound to slowly being able to do walks. I can now go on a really good day. I could do a 2 hour walk, and that was completely impossible in 2019. I have fluctuations. I have my good days, I have my bad days, but I'm having more good days with the cannabis, which is then making me able to cope with my bad days a lot more. Um, I've managed to completely lower my opioid uses, which means that when I do require it in NHS hospitals, they actually work, because I haven't got this massive tolerance that I was having huge issues with. Um, I'm not on antidepressants anymore. I don't need any antidepressants. The cannabis works for me. I rarely need diazepam. Really, it's only when my trauma is triggered that I would need it. But I manage everything with cannabis: pain, cannabis; anxiety, cannabis, and it works. And I don't take huge amounts either. It does something. I don't know what.
No, no, that's absolutely amazing. Like, and I think you did mention before that your biggest sort of concern are your kidneys. Do you want to sort of go into what your diagnosis around there, the sort of symptoms you experience there, and how medical cannabis helps you relieve that?
Yeah, so I guess I probably have like two conditions. So I have suspected Crohn's disease. So the cannabis helps with that because it stimulates my appetite, and it means that the food actually stays in my stomach long enough to digest, because I have quite bad vomiting. So that's another thing the cannabis is really good for. On a daily basis, I have a chronic kidney disease and I have chronic kidney stones, which I do pass pretty much every day, like gravel, and then sometimes they can be big stones. Um, but the cannabis just helps the pain. And I think because it's a natural anti-inflammatory, with the Crohn's, I can't take NSAIDs like ibuprofen. So again, the cannabis is perfect because it's a natural anti-inflammatory. So I'm almost getting all of the benefits that I used to have from ibuprofen from the cannabis, but not having to damage my stomach. I think it's just the best thing that's ever been grown from the ground, really. And I think more people need to be aware of actually what cannabis does to the body, because it's not just about high. There are so many other properties in it, like with the Crohn's, the fact it's a gastro and a kidney condition, and it both works on both of them. And without the cannabis, my Crohn's, I go into a huge flare. So it does work. And it means I'm not, like you said, on pharmaceuticals, which I don't really want to be on steroids and all of that. I've just managed to cut down all of my meds, and it's just, you feel so free. In my opinion, I just don't feel trapped to big pharma, because I think that's the problem.
No, first of all, thank you. I mean, it sounds like you're going through a really difficult time, and I'm sorry you have to experience that. I'm so happy that you did find medical cannabis to help offer some relief. And I get you. Sometimes you have good days, sometimes you have bad days. Sometimes one day can be start off good, end up bad, start off bad, end up good. It's literally just Russian roulette with us.
And I still have carers, so I still have the support coming in, but it's more there supporting me to live independently instead of caring for me because I can't be independent. So there's definitely that shift. And it's just nice. It's nice to be able to go to the supermarket with my carers and actually pick out what I want, and not my carers just doing all the shopping for me. Um, yeah, it's been nice. It's been a nice growth, I think. Yeah, I wouldn't, yeah, I'd be lost without it.
No, I love it. And you know what? I love what you said about having people in your life that allow you to maintain independence because, again, I mirrored that. You're no longer relying on somebody to literally help you take a bath. You can actually do it all yourself. But once you finish a few things, you might flare up. You might need help going shopping and stuff like that. But you no longer need that sort of, what I used to call, anyways, embarrassing level of support. Because that's how you feel. You feel embarrassed. You know what I mean?
Walking down the street with your carer, like at 21, like, yeah, you just feel like everyone's thinking, like, this person's committing fraud here, where well, there's nothing wrong with her, especially when it's invisible. That's a huge thing, is people just think, oh, I'm really healthy. It's like, no, that's my mask. It's something that I've learned to put on because I just, if not, I'm just miserable.
Oh yeah, no, I'm sitting here, I am smiling because again, you're taking the words right out of my mouth, and I think one of the most insulting things that I tend to find is when you have people that look at you and they're like, "Oh, you're disabled," because I have to wear, like, please offer me a seat badge because when I'm commuting and stuff like that, I cannot stand. Yeah, exactly. I can't stand for too long, and so I would need to sit down, and then you'll have people looking at you and they're just like, yeah, is she really disabled? And you're sort of just thinking to yourself, do you honestly think I would go out of my way to make it intentionally known to people that I'm disabled unless I genuinely needed the seat? Like, no, let me try and fraud somebody out of a seat because that's really the cherry at the end of the week.
I'm honestly the exact same. Like if I ever get on a busy train and like I can see like there's an elderly person or there might be someone who expects me to give up my seat, I just casually have my freedom pass out because then I just feel like if they can see, they're not going to confront me because I can't handle confrontation. But how ridiculous is it that we live in a world that we feel like we have to have some sort of proof that proves that we're allowed to park here with my blue badge, or like it's ridiculous. It's so bad. It's not okay.
No, it is, and it's, do you know what? It's sad that this is the sort of life that some people have to live, and I do understand what you mean. And I think you mentioned in terms of, like, your friends and your family sort of approving. Now, unfortunately, there is a lot of societal stigma. Like, have you experienced any of this as a patient, I suppose?
Only from doctors. That's it. Yeah, but I mean, like, even, like when I was dating, I was so worried about it. And like my new boyfriend, he's very, very like, he's fine with it. But again, it's almost like we didn't really know what the rules were because he's a first responder. So we were like, oh, do we declare it? Do we not? Like, but even his governor at work was completely fine with it. Like absolutely fine with it. It's honestly, it's medical doctors and it's mainly psychiatrists who fearmonger people. So I got told that if I continued with medical cannabis, I would get schizophrenia by it. That's by a licensed medical psychiatrist. Um, yeah. So this is the thing, is I haven't had any stigma in society. I've not had any stigma dating. It's literally when I'm in an NHS hospital trying to access my legal medication that they are withholding.
So, what do you mean trying to access your legal medication that they are withholding?
Well, like they just won't. They like threat. So I will go in and say every time I go into NHS hospital, I'm in a Crohn's flare, so I don't eat. I lose about a kg a day, and all I need is cannabis. That's all I need because it stimulates my appetite. And I say, look, I want to go out and have my cannabis, and they say to me, if you go out there, you're getting discharged and you're getting blacklisted. You're not allowed to take your medication. This isn't legal. You're not allowed to have it in the hospital. Like it's a blanket ban. When I'm in hospital, there is no cannabis.
Do you know what? Yeah, that really pisses me off, right? I think that as patients, we really need to stop putting complaints forward because this is an absolute piss take, yeah? I will not shout and go on and on and on because I can actually go on and on and on right now. The only thing that I would say, patients, if you experience this, please do come reach out to us. We will help you make a complaint because this is not acceptable. You shouldn't have to be going through that in the first place. And these hospitals, I think the only times that they're actually going to start learning is when we start putting complaints forward, and that's the same with GPs. Like, it's sad that we go out into society, and I know that there's a lot of other people that do experience a lot of stigma. I have been fortunate enough to, like you, not really experience that much, except when it comes to healthcare professionals. How is it that I work in children and family services? God, like, I'm slurring my speech over here. Sorry, but no, I, like, I work with babies, right? And I work within the children and family sector, and nobody there gives a damn. If anything, they all saw the benefits. Like, they saw me going into work struggling on opiates, barely able to walk and function, and the transformation. And they're all like, "Whoa!" Like, no one there cares. However, you go to your GP, and they immediately see it on the list, and they're like,
An interesting note to me, it's not even my own doctors. So my consultants, I've been under them since I was 16. So again, they're like, woo, yes, like finally something that works. It's the pain doctors that are like, oh, we're not really sure where our position is on it. Or the A&E doctors, or the on-call urologist that is doing, because quite a lot of the time with my condition, my specialists are at Guy's and St Thomas's, so I will go to like a local A&E, and if there's like a blocked kidney, they'll do emergency surgery. So then I'm just under whatever hospital I end up at, and it's there where, like you said, like they put me on a PCA pump, which for people who don't know, it's like patient controlled analgesiac. So it's fentanyl, oxycodone, or morphine, but it's IV, so it goes in your veins. So they would rather me be on that than just have access to cannabis. And yeah, it's because they're saying that they don't have the policy, they don't know the law, they don't know, like, if something happens to me, the liability. I think it's just that it's scared. They're scared because they don't know like this.
right. So again, I no, sorry, that's still not acceptable to me. I completely understand them being scared, yeah, and I completely understand that this is a whole new level of medication. It's so much easier to treat somebody the way that you are accustomed to treating that person. However, if that if that is not working, why would you then subject a person to that sort of like i- i- just not even intervention, because the way I look at it is torture. Yeah, you're giving me, but thank you. Okay, you're giving me all of this medication that is having these negative effects on me and not even helping me because it's more convenient for you. Actually, what you should be doing as a healthcare professional, if you look at, I believe, patient centered care is regulation 9 or 8, one of them, under the health and CQC regulations, right? It's supposed to be person centered care. That's not person centered care, right? If the person is on a different type of medication, something that you're not accustomed to, then you go do the research and you go speak to the relevant parties. There is a lot of information online that they can access. They can go and speak to a consultant at the clinic. They just don't want to do all of that work. Oh, yeah, no, sorry, I'm sorry. Like, don't get me wrong. I'm always saying negative stuff, but not all doctors are terrible, for the record. Yeah, we're just talking about the terrible ones here. Um,
The terrible ones. And I think people also aren't really aware of how depressing opioids are. So you can imagine being in an NHS hospital, it's depressing as it is, and you are being pumped basically with depressant, and you go crazy. I come out of hospital and I'm in the worst mental health state because I'm sleep deprived because I don't sleep. I'm in agony. I've not had cannabis, so I've not eaten for over a week. Like, and then I'm just depressed, and then I'm in bed, and it then takes about a week or two to then build up my cannabis tolerance again. And you're just like, well, what the bloody point was that? So I've just increased my opioids after decreasing them because of like, I'm just in this vicious cycle, really. And like with anything with the NHS, you pick your battles, and this was just one I could not be asked with. Do you know what I mean? You know what you know what I'm saying here. Like,
When you're, yeah, because you're not in the state of mind to be arguing with anybody. You just don't even have the energy to form words. Like sometimes I even forget words, like literally, you forget words. And so it's very difficult to be having an argument with somebody about your healthcare when you're not in a position to do that, which is why I get so angry because you're in a very, very vulnerable place. The fact that you're doing that, no, that's why I say it's not acceptable. This that we are people, we are patients, we are human beings, yeah, who are entitled to our medication, especially when it is legal. What doctors should be doing is seeking the advice of clinics, going on the CIC website. There's loads of information about the legality of medical cannabis there. um because I know for myself, because I work in mental health consultancy or substance, I would get some patients that have conditions that I've never even heard of, and I'll be like, oh god, I've never even heard of this. You always get every once in a while somebody that has some thing and you're like, wow. But I don't just decide that, oh wow, I'm just going to treat them the same as it. No, because that's not person-centered care. I think, right, what is the best approach for this person? Right, first of all, I need to go do some research on this, and I will get all of my journals and texts, and I would research so that I can give them the best level of care, because that is person centered care, not just doing something for the sake of ticking a box. And sorry, go on. Sorry.
no, I was just going to say, but have had a positive experience in a mental health hospital. So when I had I have also PMDD, which at the time it was undiagnosed, and basically you can just get really, really suicidal. But then as soon as your period comes, it goes. So what in one of those bad hell weeks, as the community call it, I ended up in the Lotus Suite, which is basically a temporary crisis unit for 24 hours. And luckily, I got my period while I was in there. But they let me have cannabis. They locked it up. They took me out. Like, I had full access to it. Like, I could medicate whenever I wanted. So I do have to say, my experience of the mental health service, I guess, is a lot more better. But again, I wonder if that's because they're so aware of the diazepam and the benzos, if they're actually happy for someone to be on something that's not addictive. But I do just want to praise them.
No, no, I'm glad that you said that because so in my experiences working in the medical cannabis sector, in the clinic, sorry, a lot of times you are dealing with complaints, you're dealing with a lot of various other professionals, and I always found that mental health and social care were a lot more accepting of the prescriptions and very eager to even have those conversations with me around the education, everything. But when it came to like just doctors or let's talk about health professionals, not social care, health professionals, physical health. Yeah, let's call it that. Yeah, physical health. No, they're the ones that I, in my experience, anyways, found, and I'm quite interested that you're actually saying the same thing as well.
And social care, like you said, my cannabis is a disability expense. Oh, it's huge, it's massive. Like, because I literally wasn't going to be able to afford care, so I do care contributions. And my social worker was like, no, surely we can get this approved. Like, surely, like, this is a proper medication. We've got evidence it's not available on the NHS. So, yeah, both private therapy is on my disability expenditure and also my cannabis, which is great. And that's the way it should be, in my opinion.
Absolutely amazing. And if more people could do that, I will probably touch base with you around how you got that done so that we can put that on our website. So if more people can do that, that would be amazing because it would really, really help with cost.
I think also sorry to interrupt. I do also think it's hard because if patients don't have the confidence or the like, you and I, with our health conditions and with being in the NHS, okay, if we don't advocate for ourselves, no one will. We've had to learn very early on, you want something done, you bloody do it yourself because no one is going to help you. And I think that's the problem, is that not many people are like as confident, or as, I don't know what the word, stubborn, maybe. Like, I don't take any, you don't mess with me. I will be like you. Well, actually, Patient Care Act states that you should be doing that. I will come armed. And I think that's another thing, is I think patients just don't have the same level of understanding or knowledge. to then feel confident enough to fight them, because like you said, it is very confusing, and in so many different sections with medical cannabis, the line just is, it's blurred. There's not a clear cut, okay, this is what we follow. It's just, it feels like it's just, I feel like they just went, oh yeah, let's legalize medical cannabis and let's deal with all the everything else at a later date, and then it's just been pushed further and further back from the priority list, because it's ridiculous. It's 2024 and we're still not able to get it in the NHS. What? Why? Like, do you know what I mean? I don't. I feel like it just wasn't done properly at all. It wasn't.
No, the thing is, right? Yeah, definitely it was rushed. We know that because it was never really intended to explode the way that it did. It was only supposed to be for a prescription here and there. Yeah, yeah, yeah. So it was. I think it became. I think it was a shock to everybody that it kind of exploded more than people expected it to. So all of a sudden, you're now having to do everything retrospectively. I think you mentioned something that's really important, which is it's sad that the interventions that certain people have to experience, that is just really not fair, especially when there is cannabis that can really make a huge world of difference. I, like you, have been in places where I have lost so much weight because, again, mine is more to do with autoimmune related, but I also can't. I still, so is Crohn's, to be fair. I also struggle to eat a lot. Like, and if I don't have my prescription, I actually won't even be hungry. Or I'm just, everything just goes through you. Like, you can't keep anything in your stomach. And so I do get to a point where I look like an actual alien and you don't even recognize yourself in the mirror anymore. And people don't realize that every single symptom that we have, each and every single one of those impacts us in so many different ways. Like, and if we actually sit down and break it down for people, to, again, why patient experience, why you here and talking about your experience is so important for people to understand, not just for cannabis naive patients, but also for healthcare professionals and professionals, especially at the NHS, to understand that, you know, all of these symptoms, they impact us differently. And imagine how overwhelming that is. Someone like me, I have 38 symptoms, and 38, and I can imagine with yourself, you've got equally as much with Crohn's. I know Crohn's is it's about 16 on its own. So I know you've got a few different disabilities. So trust me, I get it. Yeah. And each and every single one of them impacts you in a different way, which just leaves you so overwhelmed at the end of the day. And these are just the things that people don't understand. They would rather just scrutinize your medication than to understand simple facts for me. So basically what I'm trying to round it off to is, thank you so much for, sharing your experience and for being brave and speaking up about how this actually impacts you and your well-being. And and again, I really do have to say again, doctors, we are not criticizing the good ones, we are definitely just criticizing the bad ones. Sadly, there is just more bad ones these days than there are good ones. I think it's a lot to do with the health sector being so underfunded, but they're burnt out themselves, so I do really do need to give them credit. Some of them are just horrible.
I think, but that really upsets me, because I feel like cannabis would be a game. Like, the way cannabis has allowed me to eat, like, I can't tell you, like, I lost 20 kg in a month from severe vomiting. I couldn't eat, I couldn't keep anything down, and I was in hospital for an entire month. And I literally said to my boyfriend at the time, I was like, get me out of here and get me cannabis, because if I have cannabis, I know I'll be able to eat. And I just think how many people with cancer who are going through chemo, who are having this sickness and nausea, no appetite, who are having to take oral nutritional support or a peg tube or a feeding tube. And like you said, all they could take is cannabis and they would have an appetite. But instead, they just want to stick tubes down our throat. It's really sad. That's actually really upset me. But I'm glad you told me that, because I guess I live in the clouds a bit, thinking, oh, it's not going to be long. I'm not going to be paying for it out of pocket. for much longer, but it does seem that way, doesn't it?
And you know what, Lydia? That is an amazing point to end it on. Lydia, thank you so much for joining us here today. And thank you, everyone, for joining us today. We look forward to seeing you all again next week, where we continue to explore patient experiences. Lydia, thank you again.